Thank you for joining us today. Again, my name is Michael Scott, and on behalf of Everbridge, I'm excited to present this Expert Insights webinar, Managing Public Health Concerns and Crises, a Customer Perspective with Louisiana Department of Health. In this webinar, our presenter will discuss and examine background and introduction of Louisiana Department of Health, challenges faced, choosing a notification solution for their specific needs, and they will cover two use cases, one on hurricane statewide exercises, and the second one on Ebola virus disease, or EVD. And then he will finish off with best practices. After the session, we will have a 10 to 15 minute Q&A session with our speaker. As a reminder, you can submit your questions at any time during the webinar. You may send your questions by typing in the open text field in the questions panel and sending your questions to all panelists. If time runs out before your session is asked, we will try to follow up with you after the webinar. As always, links to the recording of this webinar and other webinars and slides will be available on our blog within a few days of the session. You can also look for a link of the recordings in all webinars on everbridge.com under the resources section. If you're on Twitter, we encourage you to take a moment to follow us at Everbridge and use the hashtag Everbridge and hashtag EBCommunity to share snippets of insight throughout our program with your followers. We'll even try and retweet some of your comments. And now it's my pleasure to introduce you to our speaker. Our speaker is Henry Yenny, and he's a program manager for the Louisiana Department of Health and Hospitals. Mr. Yenny supports the State Health Officer and the Director of Emergency Preparedness. In this capacity, Mr. Yenny is responsible for development and maintenance of key information systems supporting ESF-8 activities and supporting senior staff in their ongoing preparedness planning activities. Mr. Yenny has over 30 years of professional experience in behavioral health, child welfare, managed care, and other specialized areas in healthcare. We're excited and honored to have our expert here with us today. And at this time, Henry, I'm going to be handing it over to you.
Thank you, Michael. I think, there we go. Let's get this going.
Henry, you're in the presenter.
Okay, how about that?
There we go.
All right.
Perfect.
Sorry for that, guys. Thank you again so much for attending, and I hope you can get some useful tidbits out of this. I wanted to, first of all, just kind of explain who we are and how we fit and what some of these acronyms mean. As being part of government, you love acronyms. In emergency preparedness, we talk a lot about the National Incident Management System, which is a structure of how to manage events and disasters that was developed by the federal government and FEMA. And its component parts are agencies or operations called ESFs, or emergency support functions. And there are about 16 of those that include things like mass care, sheltering, transportation, public safety, those kinds of things. We are, as the health agency for the state of Louisiana, we are responsible for ESF-8, which is our goal. And that encompasses a lot of responsibility, ones of which include supporting critical health care facilities, hospitals, nursing homes, ICFMR group homes, assisted living facilities, etc. During an event, and that may mean evacuation, large-scale evacuations, if it's a large coastal impact, and we'll talk a little bit about that as we get into it. It also, upon shot, can't be in a general shelter, but aren't admitted to a hospital. So we have a network of those shelters throughout the state. And those are the functions. We also, unlike a lot of states, we are responsible for them, which includes, as a result of the event, as well as cemetery disinterments. And in our part of the nation, with the flooding and with the typical storm surge that comes with hurricanes, we deal a whole lot more disruption with the other kind, thank God. But Everbridge has given us some unique case with that I'll talk about in a little bit. Just to show you where we fit in the Louisiana schema chart, that might be a little hard to read, but we're kind of in the middle of 16 different range from transportation and communication, public safety and security, energy, and the big we really work with very closely there too. One is ESF6, Care, Housing, and Human Services. They operate the shelters that we provide for. And then ESF16, which is they have a lot of resources that we use, particularly during hospitals. So that's just a quick snapshot of what ESF8 is. In terms of my background, I'm a social. I started my career in 1976 and worked at a small mental health clinic, and in 1983 discovered Lotus. And that completely changed my life from a perspective of technology and how technology is used in situations and in areas that it typically was a foreign entity. And from there, I went on to work in hospitals and in managed care organizations, particularly managed behavioral health care, and worked for a couple of national consulting firms in the area of managed care, and came to work for the state in about 2004, and then Katrina hit. And as you might imagine, everyone is pressed into service, and Katrina kind of propelled me into emergency management. And as part of that initial responsibility, I was working in the front end of the morgue for the people that had died as a result of the storm. And in that role supported the state health officer. In Louisiana, the state health officer is a gentleman by the name of Dr. Jimmy Guidry, and he basically becomes the incident commander for ESF8 during a declared state emergency. And so my responsibility is to support him with the systems and the information he needs to do his job. And Everbridge is key to that. One of the bigger challenges that we faced really, I mean, Katrina was a phenomenon in and of itself that created a lot of change and created a way of approaching particularly hospital evacuation and nursing home evacuation in ways that had not been thought of before. However, it was Hurricane Gustav that occurred 3 years later in 2008 that really had a huge impact on the state and was a live lab for illustrating the shortcomings we had in technology. We had purchased systems since Katrina or become involved with systems since Katrina, but what Gustav did was kind of a punch in the gut. And I'll give you an example. You'll see by that little graphic that it kind of encompassed and impacted the entire state, and we essentially had a full coastal evacuation. And in that evacuation moved about a little over 1,200 hospital patients out of state and about 8,000 nursing home patients in state, all without any fatalities. And that's the first time I believe that had ever been done. But what it illustrated was the need for a way for us to communicate with these facilities and for them to communicate back to us about what was happening. We had several large metropolitan areas that were impacted by power outages that lasted 2 to 3 weeks. And most of these large facilities had generators, but unfortunately those generators didn't power their air conditioning systems. And in late August in 2008, there's a phenomenon in Louisiana called air you can wear. It gets very hot and very humid, and we had a couple of hospitals, large hospitals with large ICUs, where those temperatures began spiking into the mid-90s. So we came very, very close to having to evacuate large hospitals in the Baton Rouge area which had been taking in patients from other parts of the state. And so that really kind of pushed us over the edge to look at that one particular critical need of an emergency notification system to be able to communicate with these facilities, communicate to other stakeholders to give them direction, and also to get back situational awareness or visibility in what was going on with them. Why Everbridge? At the time, we had access to another notification system that was managed by another agency within the Department of Hospitals. The disadvantages to us kind of tagging onto that system was it was fairly tightly controlled by that particular office, and because of the control protocols they had over this particular system, every time we needed to notify or send out a notification, we had to re-upload contact information, and that was a huge disadvantage. It created critical delays between the time that we needed to notify people and the actual notification itself. The other big drawback that we were able to highlight was it was based all on technology that was housed in-house. Servers, 48 telephone lines, no redundancy, no backup, and it was just simply an unacceptable risk of failure should those systems go down in the middle of an event, which is entirely possible. And so we created a business case that cleared the path for us to acquire Everbridge and dedicate it to just emergency management. The advantages that we got with Everbridge was it was the right feature set. We were looking for a system that had a robust API because we had begun to develop systems that connected to a single sign-on architecture, and we wanted that same functionality for the messaging system, and Everbridge's API allowed us to do that. And there's some other things about the API I'll go into in a little bit, because basically our users don't see Everbridge. They see our front end that we created, and we communicate with Everbridge through that API. And it's rock solid. It's very easy to use. It's quick to deploy. And as I said, it's rock solid reliability. We have really never experienced a failure with Everbridge since we began using it very heavily in 2009. We believe it's got industry-leading redundancy in terms of data centers and the level of technology they have, and the costs have been reasonable. Just to kind of give you, without divulging some specifics, we pay about 1/10 of what it costs other systems that require people to house equipment on site. So it's significant cost savings for us, and because we're a poor state, all of the funding that we use for emergency management comes from a single federal grant. And as you might imagine, in these difficult budget times, we have to steward those dollars very carefully. So we're very careful with what we spend and how we spend it. And Everbridge was clearly the highest value for the most functionality, and it was kind of a no-brainer for us. In terms of our goals, as I hinted at, we were looking for Everbridge to be very tightly integrated into our overall infrastructure, and that infrastructure revolved around a security management application that allowed us to collect information on persons and users. It was a single sign-on system, and the way that it's designed, as we would create persons or users in that security management system, we could assign them to messaging groups on the fly. So just by, for example, we assign people position titles that don't have anything to do with their real-world jobs, but it has to do with what's their role in emergency management. So a particular person at a hospital may be the plant operations guy. He may be the emergency preparedness point of contact. He may be the trauma point of contact. So we're able to give those people those predefined titles, and what that enables us to do is to create messaging groups to that designated position title on the fly in minutes. And that was something that we simply couldn't do before we had Everbridge. So as situations evolve, as incidents unfold and the best laid plans start to fall apart, we begin to see the need to incorporate other stakeholders and other people in our responses and have to communicate with them. And Everbridge allows us to do that. Again, it's reliable. It's redundant. We've again never had a failure. The platform just works. And given that we're accessing it through an API, that API has been rock solid. We've been able to very successfully integrate it to the single sign-on systems. It's very easy to use. And it allowed us to build some custom functionality that is very cool for us at the time when the Aware platform might not have supported some certain types of notifications. We were able to build that functionality in our UI, such as cascading notifications and the ability to schedule future notifications and doing updates and those kinds of things are very, very easy to do and are all now very powerful in their new API. Again, we just thought it was, as we're moving from their Aware platform to their new mass notification platform, again, we're just seeing it being better, faster, and cheaper. The existing functions that we depend on are much more robust. Also very excited about Everbridge's GIS-based notification capability. That is extremely important to us, particularly if we're looking at events that are not statewide. And in this state, that happens quite a bit with hazmat incidents. We have a large petrochemical corridor, and hazmat incidents are a regular occurrence along with other sort of localized mass casualty incidents. And being able to use that GIS kind of fencing and notify people that are within 5 miles or 10 miles of a particular event is going to be very exciting to use. And it's going to really mean, from our end user point of view, little or no change. It's all being accomplished through their new API, which is much improved. It has the ability for us to preview functionality through their Swagger UI much, much easier and faster. So we're excited. We're basically right now in a testing phase, and we look to be in production with the new mass notification platform in about 30 days. So things are moving along, and just as a plug, unsolicited, their technical team at Everbridge is top notch, from Emad Modine, the CTO, to the folks that are responsible for the API and the infrastructure. They've been terrific and been very, very helpful for us. So given that kind of background and how we moved into using Everbridge, it's an application we use every day. We are able to use it for automated messaging. For example, if one of our in our network of hospitals, the hospitals that have emergency departments all use a system that indicates their emergency department status and their trauma systems status, the status of trauma resources such as neurosurgeons, orthopedic surgeons, free surgical teams, those kinds of things. And when one of those hospitals goes on diversion for a particular reason, Everbridge can automate that messaging out to a predefined group of people so that the EMS companies know, the other hospitals know that Hospital A has gone on diversion for a particular reason. And all of that is accomplished through the API and a set of conditions that allow us to automate that messaging. Another important component before I jump into that first use case in terms of automated messaging is we've got such a focus on making sure that hospitals can survive events like hurricanes, that if they indicate that they're going on generator power, and they do that through another system that we use, Everbridge will trigger an automatic notification to a small group of people so that they can begin fuel simulations. One of the probably most difficult problems we had during Hurricane Gustav was last-minute requests for fuel. We had widespread power outages, and we had no visibility into the status of hospitals and nursing homes that were on generator power. And the days were filled with receiving calls from these facilities needing fuel in very short periods of time. And we now can get ahead of that problem because of Everbridge and other systems and begin forecasting fuel shortages, and it's proven to be very successful. Let's talk about our first use case. We're doing a statewide hurricane exercise. It's an annual event for Louisiana. These tend to be very large productions, and this one doesn't disappoint. It's 6 days. That involves all of the state agencies, the National Guard, a lot of federal agencies, FEMA, HHS, the National Disaster Medical System, components of the Department of Defense, airports, EMS, nursing homes, and a variety of other players. And those are the people that we have to communicate with. We've got to, first of all, let these facilities know what their roles are and what's needed of them at different sizes, but we also trigger mandatory reporting that requires them to update their status about their operations and their power and other items in some systems. And we do that through Everbridge notifications. But one of the really nice features that comes along with Everbridge is an audit trail, where if I message Johnny and Johnny replies to my email or indicates that he received the email, I have evidence that Johnny got the email, or he answered the phone, or we left a message on his phone. Everbridge has a nice audit trail for those kinds of things, and in enforcing mandatory compliance after an event has really improved participation. We now get about a 92% participation rate from tier 1 hospitals and about a 95% participation rate from nursing homes. So it's been really useful, and that historical data that you get with Everbridge for every notification is critical to that. The major testing in this exercise is hospital evacuations, both pre and post-storm. There's going to be more of an emphasis on post-storm evacuation. We spend a lot of time focusing on getting people out before the storm hits, but there are situations where we either won't have enough time because of the short lead time in the storm's development, or some unexpected change in the conditions that require hospitals to shelter in place and then be evacuated after the storm. So we've got to communicate throughout that 6-day period with all of those facilities that are going to be impacted, and we're also communicating to them about providing certain information that we move up to the federal have-bed system. And that federal have-bed system basically gives them visibility into bed availability across the country, so that if people have to be moved out of the area to other states, they can see into those other states for available hospital beds, and likewise can evacuate to Louisiana if something happens in another state. And it will give us a tremendous situational awareness in the status of those facilities, and all of that funnels upstream to our senior state leadership, including the governor and his cabinet. We have to coordinate our messaging with the National Guard, as they're kind of the major player in this particular exercise, with our leadership and with the various associations, the Hospital Association, Nursing Home Association, those guys that have proven to be very, very good partners. We also have something called a data cell that once we message out that we are enforcing mandatory reporting requirements, at the end of every reporting period, this data cell can look into who hasn't reported yet and begin to call them to get that information. The ultimate purpose being to provide as complete a picture as possible to our senior leadership about what's going on in the field, and it prevents what I call the hallway point and shoot kind of executive decision. And this happened a lot during Hurricane Gustav, where one of our leadership team members would decide that somebody needed to call hospitals and find out how many were on generator power. And he would walk down the hall and point at this person and say, call hospitals. 5 minutes later, as he's walking down the other hall, he'd point at somebody else and say, call these hospitals. So hospitals were getting called 4 and 5 and 6 times a day by different people asking for the same information. And that in and of itself was one of the measurable benefits of Everbridge, in that we didn't have to do that kind of shotgun approach, and we could target notifications to hospitals and target notifications to nursing homes about exactly what we needed. I'm hoping this is making sense to you guys. I'm not getting a lot of feedback, and I know that's part of the deal, but I hope it's making sense. This is the messaging calendar, kind of a high-level look at the messaging that's going to occur starting on Monday. We will start sending out messaging to hospitals for a bed poll. Then we'll start messaging out to hospitals and nursing homes and other healthcare facilities about mandatory reporting that's going to occur during that week. We're going to target hospitals that are slated for evacuation, as well as hospitals that are slated for post-storm evacuation, and we'll be communicating with those facilities throughout the week. But Everbridge is the key platform that we use to do that. We also use the conference call capability of Everbridge to hold key conference calls at key decision points about whether or not we're going to evacuate and what resources are needed to make that happen. Let's talk about use case number 2, Ebola virus disease. As you know, this has been going on since about 2014. And for us in Louisiana, it's about communicating risk and response. And it allowed us to target some key staff people in hospitals across the state, and those were the infection control folks. As events began to unfold and you began to get information about what happened in Dallas and what was going on in other parts of the world, we were able to assemble communication groups that kind of gave us a rapid response in the event that we encountered a verified case of EVD. And in Louisiana's case, we partnered with the other 5 states in our federal Region 6 and created a kind of a 6-state response plan where we had identified hospitals that were going to be treatment centers, hospitals that were going to be assessment centers, how we were going to transport patients both on the ground and in the air. And Everbridge for us allowed us to target those specific audiences in our state in a very specific fashion dependent upon the event. This is one map that shows a hospital that may have a verified case, and we were able to say, give me all the airports that are within 50 or 60 miles of that hospital. We're then able to communicate with that hospital, those airports, and the EMS units about which airport is the most efficient and safe airport to move that patient to for transport to a treatment hospital. Another kind of more unusual stakeholder were crematories and the mass fatality end of things, where the decision was made that if at all possible that cremation was going to be used to dispose of remains. And we had identified crematories that were agreeable to perform that service. And what this map shows is where those crematories were located in relation to the large Tier 1 hospitals in our state. And again, that we could target those particular crematories with messages and notifications about training of opportunities, actual case opportunities. Thankfully, we didn't need to use it. and we've been very lucky so far, but we were able to test it and incorporate these folks into our notification system in a way that hadn't been done before. In terms of, I want to kind of start wrapping up with just some of the benefits that we've realized. The new API for the mass notification system is much improved over the Aware API. The bulk upload of contacts and the maintenance of those contacts is very efficient, very reliable, and very fast. The type of API, the design of the API is much improved, and we have been able and been fortunate, and I think anyone would be, to get access to the top experts at Everbridge while you're going through that transition period of developing your API. It's got immense flexibility. As I had mentioned before, adding contacts and maintaining contacts is fast and reliable and accurate. And again, it has the communication methods that meet our needs in terms of telephone contact methods, email, push notifications, other means of reaching out to our stakeholders that are exactly what we're looking for. In terms of best practices on our end, what has helped us the most as we've had Everbridge for the last, 7 or 8 years is the use of templates. We use standard templates for events and for notifications based on alert levels. And this is keyed and maintained by a statewide trauma network that handles kind of the day-to-day notifications about trauma and uses those templates to communicate the levels of emergency, so to speak, that might be occurring. We use structured messaging plans if time permits. If we see a hurricane coming or if we know an event is coming, like we do this sort of planning for Super Bowls and NBA games, we will prepare a messaging plan that starts to specify responsibilities, the key contacts, what sort of templates we're going to use, who's going to originate the notifications, who are the recipients, what are the delivery methods, what attachments we're going to use, what's the notification sequence, and if we have any predefined updates, we document all of that ahead of time, kind of in a script fashion, and then we can go to Everbridge and pre-schedule those notifications that we know we're going to be sending out at a particular date and time. This always happens where we deploy the plan and have to change it because of conditions, and so we learn from every event about how to redevelop our plan, how to deploy it in a more efficient fashion, try to adapt to the changes, measure what we're doing with the metrics that we can get from Everbridge, and just try to do continuous improvement. And it's worked very well for us in that the number of mistaken messages has decreased to almost nothing. The response time to get a message out is less than 30 seconds from the point in time that somebody calls and says, I need a notification done, or that they need to do a notification is very, very fast and very accurate now. And it's all because of that kind of focus on constant improvement. And that's kind of what I have. I wanted to thank you all for your time, and again, hope you got something out of it. And I guess I'll turn it back to Michael for some additional information and maybe some questions.
Thank you. At this time, we're going to take it over. And before we go to Q&A, I'm just going to quickly walk you guys through a couple slides just to give you a little background on Everbridge. And then I know a couple of you have some questions, so we'll definitely get to that. So I'll go through this fairly quickly. So just to give you a little background on what Everbridge does as a core services, we cover a variety of areas from global communications to contact data management. We offer reporting analytics, as Henry alluded to, mapping and security. On top of our core platform, we do have various different products to service various different industries, from mass notification to IT alerting, incident management, safety connection, secure bridge, and community engagement. And on top of that, we do have a series of different mobile applications for different uses. And as Henry mentioned, we do have an open API and connectors. So just to quickly walk through, because there are some questions about mass notification, the purpose behind mass notification was really to keep residents safe and informed during major events, and employees, and ensuring operation continuity, and reaching a wide audience from local people to travelers and visitors. An example of that is the Boston Marathon bombing, who used our solution for 1 million person shelter in place. And additionally, for agencies such as Henry's, leveraging Everbridge, we also offer commuting engagement to expand your reach. And the reason we're bringing this up is, everybody's different how they receive messages. Some people could be at work or at home on their laptop, while other people need easy opt-in and they only want messages via SMS. There are others who want rich neighborhood data, and then also visitors to your state who need a way to be, who you guys need a way to be able to notify. So one of the things we offer to customers is, one form and one button push for that wide reach. So with one button, you can essentially, depending on what your specific messaging needs are, you'd be able to send it to these various contact paths. And a little background on the company. So Everbridge was founded in 2002. Currently, we have over 7,000 public safety agencies and local agencies, and over 2,500 enterprise corporate accounts. We service 1 million contact devices. In 2015, we had over 1 billion messages sent and have 18 global data centers. So I wanted to bring this map up just to give you guys a little insight into the footprint of Everbridge and Nixle. So the first map was of all the Everbridge customers, and with our Nixle local agencies, this is the total footprint of Everbridge and Nixle. So at this time, I'm going to move over to Q&A. So as a reminder for anyone who has a question, I know we have a couple in, but if anyone would like to ask a question and miss the beginning portion with instructions, you can easily do so by going to the questions panel and submitting your question and then typing it to all panelists. And I'll leave this screen up too for anyone who needs further reminder. So the first question I got from Catherine Harrison, I'll just address because we get a few of these. So Catherine, we will be sending out the slides and the recording to everyone who attended and registered for the webinar in the next coming days. So either tomorrow or Monday you should receive it. Additionally, if for some reason you don't, it will be under our webinar section in our resources drop-down menu on our homepage. So let's jump into this. Henry, one of the first questions we got from Joe in the audience is, are you able to leverage your notification solution mobilely?
Yes. We basically, our API is built on an HTML5 basis, which allows us to use any smart device. We didn't have to do any sort of specific mobile development. We can access our user interface that communicates with the Everbridge API very easily.
Excellent. And the next question from Douglas in the audience, he wants to know, Henry, oh, I'm sorry, this is actually from Brian Fleming, I apologize. Since you're accessing Everbridge primarily via the API, where is your side of the application hosted, and how do you ensure redundancy with your interface?
We're housed in a private data center that's a private company called Venue that's based in Baton Rouge, and they have 4 other data centers across the country. one of which I think is in Boston or in Massachusetts. And so we get redundancy that way. We have about a 2-minute failover of systems should one of our primary data center go under. But the data is constantly backed up, and we have alarm systems that or those kinds of things that may cause a problem. And knock on wood, we haven't had any major failures. We're able to fail over quickly to other data centers and kind of pick up right where we left off.
Excellent. Thank you, Henry. The next question, which was actually from Doug, I can quickly answer. He wants to know, is a private computer program web connection for this private, what you're using, for sale to government agencies? And yes, Henry is a government agency, and it is for sale to public agencies. That's actually our primary customer. So if you are interested, Douglas, I could definitely have one of our product specialists follow up with you. So the next question, oh, sorry, go ahead.
No, I just wanted to follow up on the question Brian asked. The use of Everbridge and some of the other applications that we were using really gave us the leverage to move out of the state data system infrastructure, which was no redundancy, one big building by the river and a bunch of railroad tracks. So think about that. Really dangerous. And so the criticality of what we were doing and the ability to maintain the ability to communicate with healthcare facilities during emergencies really allowed us to be the first agency in the state of Louisiana to move out of that state data center into a private data center.
Yeah, and just to add to your point on the notification side, for any of you who's missed the previous 2 slides, Everbridge is SaaS-based, so it's internet-based. So as long as you have an internet connection, whether via your phone or other mobile device, you can access the solution. Additionally, we have 18 data centers worldwide, and we are able to ensure redundancy in a couple different ways. The next question is from Paul. He wants to know, Henry, he saw that that you communicate quite frequently with a lot of the state hospitals. He wants to know, during an event, can you target specific hospitals in specific groups within that hospital if need be?
Oh, absolutely. That was one of the big attractions for us was, and one of the big reasons for us to use the API is based on the criteria that we can put on a person. We can very quickly target. If I want to target all the infection control nurses in Tier 1 hospitals in a particular parish, we can do so within 30 seconds. We can assemble that group, package it up, send it off to Everbridge through the API literally in minutes. And it gave us that kind of flexibility we just couldn't get anywhere else. So yes, it requires some thought with your stakeholders, and it requires some cooperation and ongoing maintenance because we give our hospitals the ability to control who's going to get messaged at their facility. And some are better at maintaining that than others. So we have a protocol for once a quarter kind of doing a house cleaning with all of the hospitals and nursing homes and looking at their contacts and making sure they've got the right people in the right places.
Excellent. So the next, actually, it's a follow-up question from Paul. He wants to know, do you have templates put in place or notifications to automatically alert hospitals when you're having a major event and you need to send out specific messages?
Yes. One of the examples of that is in one of our regions that hospitals in that region were very interested in why and when other hospitals were going on ED divert. And so what they did was they created their own messaging group, and we were able to say whenever a hospital in that region goes on divert, shoot an email through Everbridge to this predefined group of people. The other thing this group was able to do is prior to that, they had an old system, kind of like the old Soviet U.S. red phone thing, where they had a dedicated telephone in every hospital that had an ED that was controlled by the 911 agency. And very old, very inefficient. But what we were able to do is take that old phone infrastructure and those phone numbers, and through Everbridge give that 911 agency the ability to immediately call out to all those hospitals using a couple of clicks and a template that we built for them. And that's worked really, really well.
Excellent. And so Sherry Hayes had a quick question, and I can answer this. So she wants to know a little bit more about the Nixle Everbridge relationship. So Sherry, last year, just to be very brief on it, I can of course provide you some more information offline, but for the sake of time, Everbridge acquired Nixle last year, and we've integrated some of the great features that Nixle had. And Nixle has traditionally been used by public safety via zip code opt-in. So you're simply texting 888-777 to texting your zip code to 888-777 would get you opted in, and it's a great tool that's integrated now into Everbridge as Commuting Engagement. So the next question for you, Henry, is do you have any groups you coordinate with to put these plans together during monthly meetings, biannual meetings? How often are you meeting to put these plans together to ensure they're up to date and ready for the next big event?
That's a great question, and it all kind of goes back to our experience after Katrina and Gustav. We realized that we needed a structure that was regionally based, that consisted of people from those facilities. So it wasn't like we expanded and hired a bunch of state employees to go out and be the regional representatives of ESF8 in these regions. We were able to, over a period of a couple of years, as we talked and discussed and planned, organize a group of what we call DRCs. These are designated regional coordinators. And they're people that actually work in hospitals, and most of them are volunteers. We have a few of them that region has pooled together some funding to pay them, so that they're actually paid positions by the hospitals in that region. And those DRCs are kind of our link to the facilities themselves. And so we use that DRC group a lot as a way to initiate communication, kind of float ideas to the hospitals about system changes or system enhancements, and maintenance activities. We're in the middle right now, as I said, of one of our quarterly kind of cleanups of people in the contact system. So we're using those DRCs, which have built, I mean, they come from the area, they work in the area, they know these hospitals, they know people at those hospitals, and it's worked very well for us for the past probably 8 years now.
Excellent, thank you, Henry. So at this time, we're actually a couple minutes over. We're going to conclude the webinar. As always, I'd like to thank everyone who joined us today. And again, if you have any additional questions, feel free to email us at marketing@everbridge.com, or to your, if you are a customer of ours already, your designated account manager. And we will be sending out, as a reminder, the recording and slides via email to everyone who has registered, and it will be on our website in our resources section under webinars. Again, thank you everyone for joining us, and thank you, Henry, for your presentation.
You bet. Thank you so much. Thank you all.
Bye.